and then I will be transferring over to do Q&A on TikTok. Ask an NCLEX expert. So if you're on TikTok, get on there. But we do got to read this book. Welcome, everybody. It's Winning Wednesday. If you are on your journey to becoming a nurse, an amazing nurse, then you're in the right place. You're in the right place. I see Ohio, Texas in the house. Woo! It's big in Texas. I love it there as well. So welcome all of you who are going to be a nurse. It's okay. It's okay. Somebody says, I think I would be a nurse, but I'm not a nurse quite yet. It's all right. If you can come here, Massachusetts, I see you. Virginia, I see you. If you can understand the things that we're talking about, then you're on your way to be an amazing nurse. Gambia, I see you. Open up your quick facts page. We are going to talk about the important points of being a nurse of a burn patient. And the reason why you see burns in med-surg, of course, but we also see them where? In the ICU, we see them on NCLEX, we see them on exits, because burns are very, very important to recognize early on. Okay, so we're talking about burns. I got South Carolina, Raleigh, Jacksonville, Florida. All right, Lakeland, Florida. Lots of Florida here this Winning Wednesday. All right, so follow me. I want to see you. Not here. I don't ask you to pay for this class. This is a tutoring class that I do. I don't ask you to pay for it. The only thing I ask you to do is be active in the comments. To be active in the comments. That is how you pay. So I want to see hearts on the screen. I only got 66 hearts. That's terrible. That's terrible. I need more hearts on the screen, you guys. Okay. Virginia, Cali, 815. So when we talk about burns, and I'm reading page 17 from Quick Facts for NCLEX. Let me put this down just a tad bit. Okay. We talk about burns. Burns are life-threatening. That's why they are stressed on all of our exams, because they are life-threatening due to the ability of the patient to go into shock, to have fluid shifts. So you have to be able to recognize, what is my priority if my patient has a burn? And so if I asked you, actually, what type of injury is a burn? If a patient gets burned, what type of injury would we consider that? It's not like a broken bone. It's not it's not hypertension. It's not an accident. What type of injury is a burn? Richard says, in 2019, I was with you on all your lives. I passed in 2019. Amen. Coco, I knew you would get it. Coco says it's a skin injury. She's absolutely right. It's a tissue injury. When we talk about a burn, it is a tissue injury. And we think about the function of the skin, more importantly, if that integrity of the skin gets destroyed, then what type of situation is our patient going to have? Okay, so it is a tissue injury. When we talk about burns, pay attention. That's right. I don't ask you to pay money. I ask you to pay attention, and also have your book, because it does help. So when you think about your patient coming in contact with heat that overcomes its own defenses and it destroys the tissue, then yes, I see it. Dehydration, metabolic changes, fluid loss. Probably one of the most important things you have to learn is that there will be a fluid shift when the skin is burned. That's how the body responds to burns. It starts moving the fluid around. But you got to know that. So I asked in Quick Facts, of course, what are the two age groups most at risk for suffering a burn? That's going to be children and the elderly. I'm reading from page 17. Okay. And what I need you to know is that children and elderly, in every condition that we talk about, are vulnerable populations, because children are smaller, so their body cannot withstand a lot of changes. And the elderly have less of a response. Their body is not able to get up a good response to things that happen to them. So when a patient suffers a severe burn, usually if they die within the first hour, or let me not even say that's okay. Usually if they die within the first day, let me say that. What is it that they're dying of? Because it's not the burn, right? The burn in itself is not the cause of the death. But if you have a patient and they get a severe burn and they don't survive, what actually caused the death of that patient? And I know it's not in the book, but it is me challenging you. That's what you come here for, right? Good job. I see it in the comments. So what actually would cause the death would be that shock. It would be the shock that happens as a result of the burn. Yes. So the body has that fluid shift, the blood pressure goes down, the oxygen, the circulatory system collapses. That is the result of the burn. The patient would essentially die of shock. Okay. All right. So NCLEX, they want you to know that from the beginning. Okay. They want you to be able to read, just like when we talked about, Monday, we talked about bulimia nervosa. When you hear bulimia nervosa, what is the emergency that is connected to that NCLEX wants you to see? It is suicide. Okay. That's the type of connections that you need to be able to make. So we're talking about tonight burns, page number 17 from Quick Facts. All right, good job. So there are classifications of burns. I go into first degree, which of course is like a sunburn, epidermis only. You have a second degree burn, which now gets into a little bit of all of the epidermis plus a little bit of the dermis. Third degree. What NCLEX will ask you that you probably not thought about is this question here. I'm going to ask you two today. With first degree burns, I want you to put yes or no in the comments. With first degree burns, will there be scarring of the patient's tissues? Yes or no? First degree burns, scarring, yes or no? I see a lot of no's. I see some yeses. First degree burns are like sunburns. Have you ever had a sunburn before? Yes or no? Correct answer, no scarring. No scarring, first degree burn. What about second degree burn? Scarring, yes or no for second degree burn? Correct answer for second degree burn, yes. Yes, there will be scarring. Okay. Third degree burn also as well, there's going to be some scarring. There's going to be some scarring. This is very important too, because when you talk about scarring for the patient, then you have to think, okay, will this patient need a graft or would a graft help? And I absolutely love that. If you're here in class, you are always learning. I don't expect you to know all the answers. I do expect you to be able to follow the conversation. And if you can follow the conversation, you're ahead of most people. Okay. So I go then into this formula, very popular formula. Whenever we talk about burn patient, we talk about fluid, you need to know how much fluid to give. And the Parkland formula comes up. Parkland formula. Parkland formula is unique because it only is in regards to burns. So whenever you see it in the doctor's notes, you know that this patient has had a burn. And all that I want you to know is that this formula is relevant only within the first day. Because remember, I said in the first 24 hours, if a patient dies from their burn, they're dying because of shock. That's the number one reason. So the Parkland formula helps us to avoid that death. And so with the Parkland formula, some points that you have to remember is that this is not to treat the burn. This is to treat the shock. Yes, it's critical in the first day. Absolutely. And there's time markers associated with the Parkland formula. You got it, right? So just the time that is associated with the Parkland formula, it's not the time the patient enters the hospital, okay? Because you have to give the first half of the fluid within the first 8 hours. And it's not when the patient comes to the hospital, it's when what? When does that 8 hours start? Not when the patient gets to the hospital. We're on page number 17. Not when the patient gets to the hospital, it's when the patient has the what? Yes. It's when the patient has that burn. It's the time of the burn. Not even only, and that's a good point. Only saying the time that you found them. Not, yeah. You would think that. But it's actually the time of the burn. Okay. So if a patient is burned at 9 p.m., but they don't get to the hospital till midnight, how much time do we have left for that first half of the fluid? Do a little math there. Patient was burned at 9. They don't get to the hospital till 12. How much time do we have left to get that half fluid in there? Somebody said, we ain't got much. I don't know. I ain't here for the math, but we ain't got much. So remember the first 8 hours. Okay, so that's the first 8 hours. So we have 3 hours. So we need to subtract the 3 from the 8, and that gives us the 5. Yes. So we only have 5 hours then to get that first half of the fluid in. That's how NCLEX does Parkland formula. They just want to see how much do you understand about what you've been studying. Okay. And I love that we're reading this book together, because this is one of my favorite books to do. I do like to do this book too. We will be going over the videos as well. I'm going to be switching to that. But my goal for you is that when you get this book, you know how to read it. Remember, I said, when you're reading quick facts, you need to read it like you're giving report. So you need to read it like you are giving report. Okay. All right. I'm moving on. That's the Parkland formula. So you do have to memorize it and just recognize that you give the majority of the fluid the first 8 hours. How did I get the 5 hours? Because we said the time of the burn is when this formula starts. So we have 8 hours. We have 8 hours. Okay. And so if the patient was burned at 9, but they don't get to the hospital till 12, that's 3 hours that are already gone. So when you do this Parkland formula, you have to subtract those 3 missing hours. We don't have them anymore. All right. I'm about to be done with this live. How long is this live? It's another 2 minutes and then I'm done. Okay. I only want to keep you for 15 minutes. We've been going for 14. So I got to hurry up. All right, let's turn the page over to page number 18. I put here, should the client burst a blister? Should the client burst a blister? The answer that I have here is no. You never want to tell a patient to burst a blister. But why is that? I know we say that and we know it, like that's just an automatic response. But if NCLEX dug one layer deeper and asked you why, what would you say to that? What's the appropriate answer? Okay. The appropriate answer is because what the blister does for the body is that it keeps the skin sterile, right? It keeps that broken skin sterile. Yes, exactly. It's a point of entry for bacteria, viruses. So people don't like the look of blisters, and that's why patients will break them. And so it doesn't seem like it's a big deal, but for NCLEX, it's a huge deal for us to tell a patient, do not burst ever a blister. because it is keeping your body sterile. Yes. Okay. So that was one of the things that I have on there. Check out the diet. It's very important also to understand that when a patient suffers a burn, the body will begin to burn calories a lot faster. So hold on one second. I see the questions, they're really good. So a high calorie, high protein diet is important. There's a question here that says, what if we only have 2 hours left and we need to give half of the fluid? Will there not be a risk of fluid overload? Well, this is the idea. The idea is that whether a patient receives treatment or not, the burn is already causing the fluid to leak from the body, the fluid vessels to leak from the body. So if you don't get to a patient in 5 hours or 6 hours after they've been burnt, and remember, because it is according to the percentage of the body that's burnt too as well. Look at all the notes I have in this book. This is what your book should look like. It's according to the percentage of the body that's burnt too. So you can assume that if the patient has a heavy burn, then after 5 or 6 hours, all of that fluid has been lost and they're in pretty bad shape. So your worry is not fluid overload. Actually, the patient probably is already in shock if they have sustained a very large burn. Okay, so you want to get that fluid in there. Okay. So what I was saying is that also the burn causes the patient to have a hypermetabolic state. So they would burn calories faster. There's a point on here about stress and ulcers. Patients who have endured stress are at risk for a special type of ulcer called a what type of ulcer? What is that ulcer that patients get when they're in a lot of stress over a long period of time, and it thins out the layer of the stomach lining? Good job. It's my first time here. How do I get some of the book? It's in my TikTok shop. Since you're watching me on TikTok, you can get it on my TikTok shop. Not ulcerative ulcers, curling ulcers. And remember, on Monday, I've been doing this on Mondays. On Mondays for our study session, we talked about how acidic the pH of the stomach is. That pH of the stomach acid, it's the same. It will melt metal. It's like battery acid. It's like a 1 to 2. It's like a pH of 1 to 2. So your poor stomach lining, it's not going to be able to withstand all that acid if it gets weak. So curling ulcers, you need to know that. So you can give them, I wanted to talk about the medication for this because this was important. So PPIs and H2 blockers. What's PPI stand for? What type of medication is a PPI? Come on, I know you know it. PPI is a boom. Go ahead. PPI. The reason why I say this is because I actually want to do some pharmacology tonight. So let's go to the pharmacology section. Boom. Proton pump inhibitor. Yes, absolutely. H2 blocker. So turn to pharmacology section because this is relevant. We're talking about burns. And honestly, this is how you should study pharmacology. When you're talking about a condition, always look at the medications that treat that condition. Don't just try to study pharmacology all by itself. That's a terrible way to study. If you just look at medications and you don't see how they relate to the condition. So let's go to pharmacology. I know you meant proton. You put protein. I got it though. Turn to page number. It's where we talk about antacids. There was a point about antacids that I thought maybe NCLEX would ask you. I'm going to page number. Oh Lord, what page is it, y'all? Who wrote this book? All right. Okay, here we go. Page 107. Page 107. It is the GI medications. Okay. I'm on page number 107. Okay, so do you guys see these medications? We talked about these medications before when we were discussing something. I don't know. I can't remember what it was, but antacids, histamine 2 blockers, and proton pump inhibitors. 2 of these medications will work for burns. One of them will not work for burns. And I need you to understand why they won't work. Okay. So, histamine blockers and proton pump inhibitors will work for a patient who has burns. Why won't antacids work? What's the difference between these two or these three? What's the difference? Why won't it work? What's the difference in where the proton pump inhibitors and the H2 blockers work? I don't want to give you the answers. I want you to be able to talk through them. Okay. We're doing some deep studying tonight, and I know I was supposed to end 4 minutes ago. I know I was. Okay. Okay. But these are, yes, good job. You're trying. You're trying. So the reason why is because histamine blockers, they are going to work to, that's also a good point too. It's also a good point too. Yes, antacids are short acting. That's part of it. Your patient also might not be able to eat or drink. That's part of it. So yes, absolutely. I like how you guys are thinking. The histamine blockers, though, are going to work to cut off acid. So the body actually won't make as much of it. Okay. The proton pump inhibitors do the same thing. They're going to cut off your body making that acid. This is a point you don't want to miss, right? Because it should really jump out at you. Those two will cut off acid production from being made. The antacid will only do what? Why is the antacid different from proton pump inhibitors and H2 blockers? Okay. Boom. And I'm closing the book. I'm closing the book. That's it. Okay. That is our final point for tonight. And you are right. The antacid is only going to neutralize whatever the body is making. It doesn't stop the body from making the acid, which is what we really need for our patient. Okay. That's why it's not going to be important. Now, we just did a study session. This is what it looks like to actually study for NCLEX. It is to go through a subject and is to understand it to a point where it don't matter what kind of questions you get. This is what we do, right? We do this every Monday. You guys that have my course, this is how we study. Okay. You can get a case study about it. You can get a select all that apply. You guys now know burns appropriately. And we didn't do not one practice select all that apply question. September is lock-in month. Why is September lock-in month? Because summer is over. Okay. Summer is over. Kids are back in school. You got a new routine. Let's get serious about NCLEX. And I also know summer is a big distractor. But September is the month where you have the least distractions because moving forward, your priorities are going to be competing with the holidays. And so if you need to pass NCLEX this year, I need you to check out my profile, smash the button in there. My video course right now is for free. For the first section is entirely free. Somebody says, yes. All right. So I hope you learned something new tonight. That was my goal. Every time we come together, we are essentially reading the notes that you have, but I want you to be able to read them with comprehension. And I see somebody on here past, Shoshana Rose says, praise God, I'm finally a ReMar nurse. I passed my NCLEX on August the 29th. Thank you for all your help. I honestly couldn't have done it without ReMar or God. And so this is so amazing. This is so amazing. And honestly, how we studied too, I just wanted you to see how we studied too, is that we were able to look at one condition, but we pulled in other things. So yeah, on the onset, you just see burns. That's all you see is burns. But when we got into it, we realized that, oh, there's shock here, there's dehydration here, there's infection and sepsis here. And that is how you need to be able to see things as a nurse from the top down. Okay. So if you've been studying, and this is a mistake I see nursing students make, if you've been studying just looking at body systems, just looking at the renal system, and then your NCLEX tutor tells you, okay, we're going to look at cardio, then we're going to look at endocrine. That's not what nurses do. You have to be able to see the whole picture. Okay. And so tonight you saw the whole picture. So I'm going to leave you with a testimonial, because I think we have one that's really good. Let me see if I can pull it out. Let me see. Such a good one.
Hello, Professor Regina. My name is Bianca, and I am officially a ReMar nurse. I passed NCLEX Next Gen, all the thanks to ReMar. I did your study program for about, honestly, I did it over for like 3 times, honestly. I was so nervous. I just never felt prepared. And I paid the, Board of Nursing my application fee last year, because I am a repeat test taker. This was my second time passing, and I passed at 85 questions. But I had, paid the Board of Nursing my application fee, and my application fee was only good for a year. And the year was up on June 26th, actually. That was the last day that I had to take my test. So Monday night, I decided to step out on faith, and I scheduled and booked my exam for Wednesday, the deadline of my application. So I was like, I'm not paying no application fee again, and I don't want to pay application fee again. So I prayed that Monday, I prayed Tuesday, I prayed Wednesday, I prayed before I took my test. I took a break, prayed in between my break. I wore my shirt that said faith over fear. I was ready. I was not nervous going into there at all. Like everything was just riding on this second chance. And Thursday, I found out that I passed, and I cried so bad. I wanted this for so long and so bad. I went to nursing school in 2019, finished my nursing program in 2020. No, I went to nurse school 2018. I'm sorry. And I finished my program in 2019. I took my test in 2020 and wasn't successful, and I never went back. I was going through a lot in my life at that time, and I knew I wasn't ready when I took the test, and I knew I didn't pass while I was taking that test. So, I just kept putting it off, kept trying to study. Nothing was helping me. I tried to read my, what was it, like the NCLEX, the book that we get in nursing school. I tried to study with that. That was just reading. That doesn't work for me. I can't sit there and just read and study, so it didn't work for me. I used UWorld, didn't work for me. I used another study program that was just questions after questions after questions. It was no content. It was nothing that made it stick. So it just didn't work for me. And now I can officially say that I passed my NCLEX. And all I can say to anybody else is, if you've been studying for a long time, go take that test like I did. You just gotta pray, and you just gotta be consistent, and you have to, no matter how you feel, no matter what, you have to stay motivated and stay consistent with your studying, and you will pass. This test will open so many doors for me and my family. I can finally see a better future for me and my family now that I have my nursing license, and all thanks to you. Thank you.
I love it, y'all. That's what I'm talking about. This is Winning Wednesday. Let me put my camera back up for everybody on TikTok. Winning Wednesday. That's what it sounds like. That's what I look like. What I loved about it is she was a 2019 graduate. So we're talking about years. We're in 2025, the year of our Lord, right? So if anybody has any excuses about being out of school too long, I can't do it, I don't know if I have the motivation, she literally just said, now she sees the doors that are open for her and her family. She sees it afterwards, right? And so you might not be able to see all the steps, but you certainly can appreciate the fact that NCLEX and passing this exam will open doors. So I can tell y'all a million times that you can, you will, you must pass NCLEX, but it's better for you to just see somebody that said, I have every reason not to take this test, but I'm just going to give myself one more opportunity. So congratulations to her. And I also always appreciate you all who come on and say, hey, I passed using the program. That's really, really cool, because yes, you need to be able to pray your way through it. Most of you are testing pretty soon, so I'm really excited for you. So I just want to say thank you so much for showing up for Winning Wednesday. You're showing up for yourself. Many people should have been here, but they had a reason not to be, and you had the same reasons not to be, but you decided to do it. So if you click on my profile, or if you check out that right there, September is lock-in time. Let's lock in, let's get started. And as always, I'm hopping off Facebook and YouTube right now. I will see you guys later. I'm heading over to TikTok to do some question and answers for you. I have over 100 of you, so I'm going to do some Q&As for you there. But thank you guys so much for attending class, and I will see you later. Bye-bye. Love it, love it, love it, love it, love it, love it. All right, TikTok. And for you,